Hi, thanks for your inquiry about dental implants. My name's John Swarbrigg and I'm the owner of Farsley Dental Practice. We have a unique 5-step process that we'd like to talk you through if you're interested in considering a dental implant. The first part is our assessment, where we'd like to invite you along to the practice and we can look at the reasons behind why you might think you need a dental implant. This covers a comprehensive clinical exam, we take photographs, we do digital x-rays, and we can assess in detail the site, the position and what might be required. Once we have this information, the next phase we move on to is the second step, which is the planning phase. Most often for this we'll need then a 3D bone scan of the area, which costs £150 for a small area of the mouth. And the majority of implants that we place, this scan will cover it. If we do a full mouth, this costs £300. And after we have all this detail, we can then start the planning process in earnest, where we can look in 3 dimensions at the bone that we have available. We also do a 3D scan of your teeth and convert this using a special program where we can then create an avatar model of your mouth and do virtual surgery, so we can see in precise detail whether the implant is feasible or not. And I think the 2 words always for me are safe and predictable. We want to make sure that it's safe to place the implant and we want to make sure that we get a predictable result. So the planning phase really for me is where it's worthwhile investing a little bit of time and money to make sure, if we're going to invest fully in a dental implant, that we get the best result for you. So once we've done the assessment and once we've done the planning, we can then produce for you a detailed report which outlines all the costs involved. And I'll run you through now the next 3 phases of the treatment, which is the placement. So the placement of a dental implant, if it's routine, comes in around about £1,200, and this includes all the fees for the surgery, the digital surgical guide that we produce from the planning, and the follow-ups, the stitches, the removals, the x-rays, etc. And most of the time we'll be able to place the implant following the planning, and then we'll leave you 6 weeks to heal. Once you've healed, then the next phase is restoring the implant, which we would then uncover the implant and place into it an abutment which links the implant from under the bone to outside of your mouth, and then on top of that we restore it with the crown. On average, depending on the style of the abutment and depending on the type of crown, you're looking around about £1,300 for the abutment and for the crown all included. So in total, most people would say to them, look, on average you need to budget around about £2,500 for the implant and allow £150 for a scan. The final phase for us then is the maintenance, and we like to look after our implants. I've been placing implants since 1999. And a small number do get problems. So we don't like to just place and then forget you. We do like to look after you each year. And I think maintenance is often missed out as part of the implant planning, because once you've invested that sort of time and effort and money into the implant, we want to make sure that it then lasts you for the rest of your life. And so we'd like to see you once a year, and we like to do a simple assessment of the gum around the implant, and we like to do an x-ray to assess that the bone around the implant is responding well. And again, on average, the charge for that each year is about £35. But again, for us in the long term, that means that we're guaranteeing the best long-term result. Thanks very much for the inquiry. I guess the next stage, if you're interested, would be to come along for the assessment, and where you can speak with one of our treatment care coordinators, and then hopefully they can facilitate a booking and we can go through in person the first stage. Thank you.